Okay, all I need is this. Thanks, John. And so I push to go forward and to go backward.
Yes.
That's it. Okay, so that's who I am. I spend my days doing the three things required of a university faculty member: research, teaching, and public service. My classes usually have about 6 people. Maybe 2 will be physicians doing a residency, 2 will be PhD students, and 2 will be master's students, and probably 3/4 will be women, which I think is refreshing. First, I'd like to say we absolutely need to have clean air. The question I raise is it clean enough already? I believe it is, and I believe that we have very little to do more in cleaning the air from a toxicology point of view. The second thing I'd like to say is I've worked with a lot of scientists in the EPA, and all of them that I've worked with are good people, they're strong scientists. The problems come from the top, I think as John Dunn described. And I once questioned the use of science by EPA and was told by the administrator's right-hand person she wants to hit a home run, which I don't think is a good way to use science when public health is at stake. Why am I here? In Tulsa, I learned the smell of hydrogen sulfide, and I actually learned to love it. When Tulsa was the oil capital of the world, we were proud of that. I think Houston moved in, and maybe even some areas in Louisiana, and edged us out. But I have a fond memory, and I think it didn't kill me, so it made me stronger, being in that region. My dad was in the Navy. I went to San Diego State and majored in physics with a minor in math. They didn't have a PhD program. I entered their master's program, and I majored in nuclear physics with a minor in radiation biology. I was concerned about atomic warfare and about nuclear accidents. So I learned a lot about what happens when particles get into your body. University of Rochester was left over from the Manhattan Project. They were the secret radiobiology project that studied basically inhaled radioactive materials produced in, they were generated in producing the bombs. The scientists were left over with lots of money when the war ended, and they formed a group at University of Rochester, and their director became the dean of the medical school, and they had a group in radiobiology and toxicology. I did my PhD there and did inhalation studies in animals and looked at the fates of particles in the body. These radioactive particles are really good to study because they tell you what's going to happen to non-radioactive particles, and you can trace them. I was enjoying a postdoc at Lovelace. If you saw the movie The Right Stuff, where the astronauts trained, the Lovelace brothers set up clinics. But they also set up a research lab on Sandia Base. And when they gave all that land to the military to help in World War II, they said, we want a laboratory that does non-classified work on the base. And so that's where I did a postdoc. We did castings of lungs at autopsy, and we made measurements, and we plugged those into computer models to see where particles would deposit. We learned a lot there. Interestingly enough, this was when Linda Lovelace was making movies, and I remember getting a letter to the Linda Lovelace Foundation. And we weren't that wild, really. We were pretty much nerds. I got a call. I really enjoyed Lovelace. I enjoyed Albuquerque. My 4-year-old son called it Apple Cookie. And got a call from Harold Hodge, my advisor's advisor. You could call him Yoda if you would like. And he was the first president of the Society of Toxicology. And he said, California is in trouble. The cartel is going to put an embargo on their oil. And they're going to have to use coal, and they're going to have to use dirty coal. And you remember London in 1952. A lot of people died. Inversion, dirty coal, stagnant, cold. In Los Angeles, we have 340 inversions a year. And often it's chilly, and the Air Resources Board was panicked over how are we going to protect the public when we add coal soot to the air? So I started the lab. I decided not to study pathology so much as lung defenses. At Rochester, I took about half the medical courses, lung pathophysiology and so on. So I figured that if the lung defenses work, you're okay. There are smokers that can die with healthy lungs. Not many, but there are some. And miners, coal miners, and so on. So as long as your defenses are working, you're pretty much okay. So I developed some new and some old endpoints, maybe 15 or 20 endpoints, 4 species, so we could extrapolate. And came to the conclusion, really, that it took pretty large concentrations of air to harm the lung defenses or the lung, and that combinations of pollutants, for example, some of the coal particles, when mixed with ozone, were actually protective, because the coal particles were triggering an effect of increased mucus production, sort of like if there's something irritating your eyes, they water, and that's a protective effect. So we found more of a protection than a synergism between the pollutants. Being on the university, there's some committees that I've been involved in the bottom, including those for EPA and NRC and so on. I got a call one day from a regulator. There were headlines all over saying 64,000 people a year die from particles that are not regulated. And that's when, I don't like to use names so much, but she's sort of a friend, Mary Nichols, came in to be in charge of air and radiation. And Mary told me, she said, you know, I'm in charge of radiation, I don't know a damn thing about it. And I gave her advice, but Mary, being an activist lawyer, doesn't really accept my advice very thoroughly. But Mary knew what she wanted to do. She wanted to have a particle standard, and when she took the job at EPA, she said, I knew what I wanted to do. And when the scientists did all the reviews, and you got about 3 feet of data, she said, I could point to that and say this is what the standard is based on. As a result of that phone call from a regulator, he said he was worried that all these headlines were going to cause California to have draconian standards, and the U.S. as well. What do I do? And I said, you support a conference. So we brought the epidemiologists together, we brought the counter epidemiologists together, and we had a conference. And as a result, I wrote a book called The Particulate Air Pollution Controversy. I felt it was my duty to pass on the problems associated with the assumptions we were making about particulate material. Jim explained particulate material. I think the key one is a couple key ones. The second one, this is mass-based. So you're judging the toxicity of something on the basis of mass. Imagine if you did that for medications. You know, judged whether a medication was toxic or not by how much it weighed. This is the only pollutant that's regulated on the basis of what it weighs. And I won't use the word insane, I'll just say it's crazy. It's the weight below a certain size cutoff. Now this cutoff is not clean. It has a efficiency that gets lower when to collect in a pre-collector, collect the big particles. The efficiency declines as you get away from 2.5 microns, and the efficiency increases as you get below. So it's not a sharp cutoff. Composition is not considered. It varies every hour. It varies every square mile. It varies in every region of the country. We think of particles as having roughly 3 modes. The big mode there on the right is natural, pollen, fog, volcanic dust, allergens, and so on. The head of pulmonary physiology, when I came to UC Irvine to start the Air Pollution Health Effects Lab, said he has patients that are so sensitive that a part of a pollen grain can trigger an asthmatic attack that could potentially be fatal. So if you look at those curves, you see the left one there bleeds over into past the 2.5 micron cutoff, right? So that means every PM 2.5 monitor is contaminated with the natural particles. And there are people out there that one of those particles could kill them. The next curve, if you're an engineer, you'd enjoy this, so we're going to skip it. But if you have a microscope and they're all looking at the same sample. The person with the microscope says, oh yeah, the particles peak at about 0.01. If you have down at the bottom, you're weighing mass on size segregated, they say there are two peaks, about 0.2 and about 0.4. The one that's probably biologically most important is the surface area, because that's the contact of the particles with your body. My wife's a cartoonist. This is John Doe. And I mentioned 64,000 deaths. Don has mentioned deaths. And now we're going to look at a person who actually died. He's a cartoon character. And John Doe, he's anxious. He lost his job. And by the way, I teach occupational health, and the most dangerous occupation is unemployment. And how about their families, too? Poor medical care, etc. He's overweight. He's a smoker. He has cardiovascular problems. He has diabetes. He can't afford an air conditioner. Lost his job. He has a cold that day. It's hot, and there's an inversion. Normally, the air gets colder as you go up, so pollutants rise. But if there's a warm layer, and there are about 8 or 10 things that can cause that, everything gets trapped. So the air was full of everything that's emitted, and the wind wasn't blowing it away. This would be vehicle exhaust, it would be people barbecuing, it would be road dust, it would be pollen, allergens. And sure enough, those who are measuring PM 2.5 said it's elevated today. Remember the dog in this picture. It'll come up later. John Doe's risk factors I mentioned. So we will go on past that. And the day he died, a truck drove by his house. The dog chased the truck. He jumped up. Now he's got a cold. He's drinking a beer. His medications were on the table by him. He chased the dog. It was uphill. He collapsed. He died. I asked a physician, what's going to be on his death certificate? And they said, MI, heart attack. So we have some questions here. What killed John? Now, the epidemiology that you've heard discussed would say the particulate material killed John. PM 2.5 killed him. And so KSAC PM, which I was on, most of the people there on that committee who are doing research with EPA money would say we've got to tighten the standard. We've got to get rid of diesel trucks. We've got to get rid of human activities. I think a cardiologist, of course, would say it was his heart disease and his obesity and his exertion. I think an endocrinologist would say diabetes killed him, and so on. A psychiatrist would say it was the anxiety. Chamber of Commerce is going to say it's his not having a job and low socioeconomic status. They were the people that nominated me for the Scientific Advisory Board. And I thank them for that. Of course, I haven't seen the workload yet, so I don't know. Educators are going to say one of the strong associations for people who die during air pollution episodes is low socioeconomic status, low education, which is interesting. When I presented this material to a group, I think of businessmen, and I said, what do you think killed John? And someone shouted out, it was the dog. So I think it was the dog. So I think the animal rights people who want us to have leashes on our pets could claim his death also. But now you've got John with about maybe 20 different groups claiming his death. And there's your, 64,000 people died, and John was one of them from particulate material. How would you have prevented his death? My wife's a nurse. She said he needs a higher level of education so he knows how to take care of his body. But should we tighten air quality standards, wipe out businesses? We've lost almost all of our small businesses, trucking and so on, that are owned by families. Some 5 generations have lost their family business because of the tightened standards. Now, the big companies, I think the diesel engine manufacturers don't mind because they get to sell retrofit pollution control devices. But anyway, you can think about that. How could we have prevented his death? PM as a poor metric. A metric is something you can measure, and it relates to whatever you're interested in so that when you control it, the problem decreases. I mentioned it's not stable. The thing I'd like to mention, and John and Jim Instrom mentioned it, the doses are minuscule. If you had to have a gram of this in your lung, and what Jim didn't mention, I'm the dosimetry person, so I haven't mentioned it to him yet, is you exhale 3/4 of these particles with each breath. So it's only a quarter. So I estimated to get a gram in your lung, which is nothing, it would take approximately 100 years because you're exhaling a lot of it. Your clearance acts, so to have a gram, it would be impossible at the highest level, and I did these calculations assuming 24 hours a day, you were at the highest level of PM, and you were outdoors 24 hours a day instead of 1. So that is such a small dose. I know of absolutely nothing chemically that could come close to causing a death at that rate, not botulism toxin. So I think that the conclusions are that PM is a poor metric. Mass instead of composition. PM 2.5, it would have had the most minuscule contribution to John's death that day. Yet it's claimed as what killed him. When we do a risk analysis, this is actually a new thought. We shouldn't do it on chemicals one at a time, like look at the dose response of PM in mice. We should do it on a decision we're going to make. You want to tighten the PM standard to prevent John's death? Do the risk analysis on that decision. Did it put people out of work? Does that cost lives? Does it raise the cost of food? Instrom's papers at the top, I think that's probably one of the most important papers that's been written in the last few decades. Thanks very much. Okay.